My name is Caleb Omondi. I work with the Ministry of Education in Bungoma County. I want to take this opportunity to thank partners that have come in to support our schools as we improve health and sanitation in our schools. We have worked very closely with the Ministry of Health in ensuring that we improve the health of our learners. We have had programs like the deworming program, which we have been doing every year, aimed at making sure that we do away with the intestinal worms that we know have been affecting school attendance, where sick children are not able to attend school on a daily basis. Through the deworming program, we have been able to improve school attendance. Also issues like the hygiene in our schools. We all know that hygiene is very important. When the hygienic conditions of our learners are good, then they are able to attend school and they are able to attend their lessons successfully. However, as schools, the Ministry of Education has been having challenges in terms of availability of sanitation facilities to our learners, where we find that in some schools, the pit latrines or the toilets that are to be used by the learners are not adequate. On average, we expect that for the girls, for one hall is supposed to serve about 25 girls, while for the boys, they need one hall for 30 boys, and then a urinal. So you find in some of our schools, the sanitation facilities are not adequate, and that is something that we are focused on making sure that our schools improve on the number of toilets so that our learners are able to access those facilities. Schools have water for learners to use, but in most cases the water is not adequate, because on average in our boarding schools we need about 20 liters of water per learner. But you find it may not be very easy for all our schools to be able to provide that. Then for day schools, we need about 5 liters per learner. So we are focused on making sure that we improve on the amount of water available. So we encourage our schools to improve on the storage facilities. So the water may be available in school, but the water points should also be placed in such a way that our learners are able to easily get access to that facility. And again, more importantly, even how is the water point? Is it a point that can be accessed by every learner? Does it take care of the learners with the special needs? The issue of disposal of waste in our schools is also a challenge, and we want to encourage that our schools come up with a waste management system so that we continue to improve the condition in our schools, so that we provide what we call a child-friendly environment, an environment that is inviting to all our learners. And therefore, we are very happy that we have partners that are coming in to support our schools, because we may not be able to provide those facilities all at a go. So we continue to encourage more to come.
Ambayo yanaweza zuiliwa tu kwa kuweka mikakati rahisi, na utapata ukienda kwa hospitali, watu wetu wengi wanagonjeka kwa yale magonjwa ambao yanaweza zuiliwa kwa urahisi. Kama vile utapata kwamba kuna magonjwa ambayo yamepuuzwa kama minyoo, kichocho, kuna ile tunaita pia Jiggers, funza na kadhalika. Tuko hapa kuangalia ni jinsi gani tunaweza kushirikiana kwa pamoja tuweze kuangamiza. Na tunataka kutoa mwito kwa watu wa jamii kwamba Magonjwa mengi tunahitaji tu kuzingatia usafi na kufanya mambo machache ya kubadilisha tabia yetu vile tunayo. Kwa mfano, kuhakikisha kwamba tunakuwa na jinsi ya kuweza kutoa taka yetu ya mwili, hiyo ni choo. Ukuwe na choo ya kuweza kuweka kinyesi ili isije ikadhuru watu kwa njia ya kuingia katika sehemu za maji. Vile vile tuko na elimu inatolewa na wale wana afya nyanjani, wanatembelea nyumba kwa nyumba kuhusu usafi. Ninaomba kwamba tubadilishe tabia zetu na tuweze kufanya mambo haya na tutakuwa tumepunguza maradhi.
I'm Solomon Mwaniki. I work for Amref-Health Africa in Kenya, and I coordinate the neglected tropical disease program in Bungoma, supporting Bungoma, and we also in 3 other counties, Trans Nzoia, Kakamega, Vihiga. And specifically, we are addressing 2 neglected tropical diseases, that is Bilharzia or schistosomiasis, and also the intestinal worms. And here today we have converged to as WASH identity stakeholders to discuss on how we need to move forward, how we can be able to work together, how we can be able to collaborate and integrate in terms of addressing the water sanitation hygiene issues, and also the neglected tropical diseases that are highly prevalent in this county of Bungoma. Joint implementation, leveraging on the resources, and be able also to advocate for the county government to allocate and invest more resources on WASH identities so that we can sustainably be able to address these issues of WASH identities and also be able to eliminate the diseases that we are tackling. Again, we are also pulling together the private sector for private-public partnership so that they can also invest in these issues that the county is really leading us to complement on what they are really doing in the county. We have been complementing what the county government is doing. We have been supporting them to the journey to elimination of the 2 entities, that is schistosomiasis, that is Bilharzia, as well as transmitted helminths. And for the last 2 years, we have covered great milestones where we'll be able to establish the prevalence midway of this program, sometimes this year, but based on indications in terms of prevalences and the intervention that we have conducted, we are sure that the milestone and the prevalence have really reduced. And we have been engaging in the various aspects of behavior change communication, because it's a key pillar in terms of making sure that these diseases are being eliminated. So we look forward that in this collaboration, this leadership and support from the county government and the other partners will be able to meet the elimination threshold or the goal of the program after the 5 years.